The integration of primary care and mental health is doing more to reduce stigma than anything I've seen. It means that people with mental health problems go to the same centers as other people, and in that center, primary care center, the resources are there to deal with the mental health issues at the same time.
If you're in primary care, you are treating mental illness. A third of your patients will have a mental health diagnosis. Up to 50, 60, 70% will have mental health symptoms.
Primary care practitioners interact with people struggling with mental health issues much more than mental health practitioners. So they have an opportunity to really be a bridge to link people with maybe more intensive services needed. But because people are often first presenting some of these challenges in a primary care environment, it's really critical that practitioners engage in an empathetic, hopeful way.
Connecting mental health and physical health, very much agree with the World Health Organization's definition of just health, where it's the balance of mental, physical, and social well-being, not just the absence of disease or infirmity. And that ties into the whole person.
You know, people with mental health diagnoses are more likely to suffer from physical ailments as well, and so it actually should increase your suspicion for physical diagnoses.
People with mental health challenges tend to die 25 years earlier than the general population from treatable medical conditions, and often these are conditions such as diabetes, cardiovascular disease, respiratory disease, HIV, AIDS.
Chronic diseases like hypertension and diabetes are significantly impacted by people's stress levels and their mental health state, and vice versa. People with mental health issues, some of the medications they may be taking may be contributing to increased risk for physical health issues.
I was seeing this doctor who wasn't really listening to me very well, and he decided to prescribe me a different anti-seizure medicine. And I filled out a prescription. I came home and I looked at the warnings, and it said, "Do not combine this medicine with these list of medicines." And one of the medicines I take to sleep because I have insomnia. And I called him the next day and I was like, this says it's dangerous to take with this. And he's like, "You know what we'll do? You're just anxious. I'm going to give you a list of things to do before bed just so you'll be less anxious, and then you can sleep and just take your meds." And he was ignoring the fact that I've had insomnia for over 3 years, that going to sleep isn't just as easy as don't eat 5 hours before bed or don't look at your phone. It's a chronic thing that I've had.
There's a culture that exists among health professionals that often creates barriers for people seeking mental disorders. The first step is to admit that, and then to get busy changing it.
Stigma plays a role because a lot of times people don't feel comfortable in the primary care environment, and often the primary care staff or even the physician won't they may have certain preconceived ideas and notions about what someone with a mental health condition looks like or how they react.
My mental health has definitely gotten in the way of doctors treating me for my body. An example of that would be for the past year and a half about, I was experiencing like classic symptoms of celiac disease, which is actually can be pretty serious, and it kept getting worse and worse. And I kept going back to the doctor and saying, "Please listen to me. I know my body, like I'm getting sicker and sicker." And they're like, "You know, you had this overdose a couple months ago or like a while ago, and you have anxiety, like it's probably just an anxious stomach." Finally, a year later, they did a simple blood test for celiacs, and it came back positive.
Those of us who've treated people with, you know, serious schizophrenia where the communication's really disorganized or there's almost no communication at all, of missed abscesses and misdiagnoses because you're not getting the history that you want to get. So rather than assuming there's nothing going on or assuming that whatever's going on is attributable to the mental health diagnosis, I think it's really important to step back and say, whoa, this is careful territory.
We had a case manager who called the clinic and said, you know, so-and-so says they've been stabbed. That's ridiculous. We know she hasn't been stabbed, but we need to have her seen anyway. So she came in, and I remember hearing the story, and it was all about a stabbing, and it was really confusing. But I ended up, of course, doing a physical exam, and lo and behold, she had a very significant skin infection on her belly. And she ended up needing to be hospitalized for it. So that was a real learning for me of listening with an open mind to the stories and knowing that the surface of the story might sound fantastical, but there may very well be elements of deep truth underneath that I, as a primary care provider, as a physician, need to listen to.
Particularly with mental health issues, part of the process of recovering and addressing challenges is learning how to recover from within. So unlike some other issues like a pneumonia where a practitioner can prescribe a pill and cure, the cure has to come from the relationship.
People with mental illness suffer from the stigma. They can often be written off as not able to tell their stories well. So I think you really have to have a good relationship with a patient and sort of hold yourself in a calm and accepting place such that as the story emerges from the patient, you can take it in.
The beginning of the appointment is really critical. So starting with open-ended questions, introducing yourself in sort of a calm and slow way. If you have a computer in the room or a chart, at the beginning of the appointment at least, really taking that moment to sit there and be present for the individual that's coming in to see you.
Well, this was a 16-year-old patient. He was about my complexion. He was paranoid schizophrenia. And he just would not tolerate any white person coming into his room. I mean, that was a battle cry. And so I was the only one who could talk to this patient. I was just a junior medical student, so they had to work with me to make sure I knew what to ask him and all that. And so I worked with him for almost a year. And afterwards really presented grand rounds, to all of the other students and residents. But I became really attached to him in a lot of ways because I understood for the first time what it was like to struggle with the mental illness as severe as paranoid schizophrenia. And so I think since that time, my concern, also relates to the fact, obviously I've had family members with mental health problems, as most of us have, but I've also developed the attitude that people can recover and that there's hope and that we can empower people to go on with their lives.
I think the relationship is the most important clinical tool you have at your disposal when we're talking about complex behaviors and mental illness.
Remember that mental health issues can be contributing to physical challenges, and physical issues can be contributing to mental health.
The most important thing doctors can do to serve their patients, especially patients who face mental health challenges, is to really listen, is to throw away preconceived notions of what health is supposed to look like and really take it case by case.
You need to have a real sense of meeting your patient where they are, knowledge about stigma, and how to reach across the divide and try to destigmatize that for patients.
You can't underestimate anybody or any circumstance, and you always have to hold hope. Recovery is possible. I wouldn't say it's the exception, but it can be a rule.
And as health professionals, we have to respond with a high level of concern, and we have to make sure that we're prepared to make a difference in the lives of all of our patients. So we have to make sure that if we don't have the knowledge and the skills, we are connected to a system of care where we can assure that the patients get what they need.